Hello there, I'm Stephen Bunting and I'm a physiotherapist working in the northwest of England. If you're new to the channel and want to know a bit more about me and why I'm making these videos, then I'll put a link up here, or you can see the description below. Okay, so without further ado, let's get stuck into today's topic, thumb osteoarthritis. As usual, before we get started though, please note that this video is for general information only and assumes that you've already been diagnosed with thumb osteoarthritis by a healthcare professional, or that maybe you're just interested in learning a bit more about the condition. Please see the description below for more information and my disclaimer. As with all my videos on MSK conditions, I'll be answering the 3 most common questions asked by patients, and I'll put timestamps to the relevant sections if you want to skip around. So number 1, what is thumb osteoarthritis? And within that we'll also discuss how it's diagnosed. Number 2, why have I got it? And number 3, what can I do about it? Okay, so let's dive into question 1. What is thumb osteoarthritis? Well, to answer this properly, we first have to understand what osteoarthritis in general is, and I've tackled that in depth in another video, which I'll put a link to here. In today's video, I'm just going to concentrate on the specifics of thumb joint osteoarthritis. So first let's look at the basic anatomy of the thumb. So the thumb consists of a series of bones and joints. From the thumb tip, we first have the 2 phalanges, distal and proximal, connected by the interphalangeal joint, which is a bit of a mouthful, so we shorten it to the IP joint. Next, we have the metacarpal bone, which connects to the proximal phalange by the metacarpophalangeal joint, which is even more of a mouthful, so we shorten this to the MCP joint. Next, we have the basal thumb joints, which connect the thumb to the wrist bones. The wrist itself consists of 8 small bones called the carpal bones, but only 3 of them are directly associated with the thumb. Firstly, we have the trapezium bone, which connects to the metacarpal by the carpometacarpal, or CMC joint. And finally, we have the joint between the trapezium and the 2 other carpal bones, the scaphoid and the trapezoid, which, as you can imagine, has another long and complicated name, but which we shorten to the STT joint. And then to complete the picture, the scaphoid then attaches to the radius bone in the forearm to form part of the wrist joint. Now, any of these joints can be affected by osteoarthritis, but by far the most commonly affected are the basal thumb joints, the CMC and the STT joints, and so that is what we'll be focusing on in this video. As we've discussed in my other video, osteoarthritis involves a thinning of the cartilage that covers the bone ends, and the typical symptoms of basal thumb osteoarthritis is pain at the base of the thumb, just here. There is often a dull background ache which worsens with thumb use, typically pinch gripping activities such as squeezing objects, opening jars, or turning a key in a door. In later stages, the thumb may stiffen. You might feel a grinding sensation during thumb movement, and the shape of the thumb might change, which we call thumb base squaring. The diagnosis is made based on having the typical symptoms combined with some form of diagnostic imaging, usually a plain X-ray. Here we can see an X-ray of a normal wrist. This is the CMC joint, and this is the STT joint. This X-ray shows osteoarthritis of the CMC joint, and this one shows STT joint osteoarthritis. This X-ray shows late-stage osteoarthritis of both joints with squaring of the thumb base. Okay, so now we know what thumb osteoarthritis is, let's move on to question 2. Why have I got it? Well, osteoarthritis tends to affect joints that have to cope with both compression and rotational stresses, commonly the hips and the knees, but the thumb base joints also fall into this category. They have an important rotational function compared to the other joints of the hand, and it's this rotation that gives us our opposable thumbs. There's also a compression component when we grip things, and it's these 2 factors that make the thumb so susceptible to osteoarthritis. Indeed, one study found that 22% of the over 50s in the UK are affected by thumb base osteoarthritis. We also know that women are up to 6 times more likely to develop the condition than men. We think this is because women's joints tend to be more flexible as they have more laxity in their ligaments, and hence they experience more of those rotational stresses across the joint surface. The condition is also more common in people with jobs or hobbies which involve repetitive overuse, such as textile workers, musicians, and indeed physiotherapists. Okay, so let's move on to question 3. What can I do about it? Well, if you've seen my other video about generalized osteoarthritis, you'll have seen how important regular exercise is in helping the condition. But while the evidence strongly supports the use of regular exercise for most arthritic joints, it's less convincing when it comes to exercises for thumb base osteoarthritis. This may be because the thumb is such an active joint in most people that it rarely needs additional exercise. But if you do try exercise as a first-line treatment, then in my experience, it's best to use movements that don't compress and rotate the joint at the same time. So, avoid strong pinch gripping activities or other strenuous movements, which will usually be the type of activities that aggravate the symptoms anyway. Instead, do regular simple movements to help with joint stiffness, such as thumb to finger tapping, but try to keep them pain-free. What does help for most people with the condition is some form of splint to help support the joint when doing those activities that cause pain. The idea of a splint is to support the joint while still allowing some movement and hand function. Some splints will provide minimal support but still allow a lot of thumb movement, and others will provide lots of support but not allow much movement of the thumb at all. And what works best for you will be the splint that provides enough support to reduce the pain while still allowing enough thumb movement so you can still use your hands for the things you need to do. If your hand was in a plaster cast, then no thumb movement occurs and there's no pain, but you can't use your hand. At the other end of the spectrum, a simple piece of tuber grip will provide hardly any support and therefore hardly any pain relief, but will allow almost full thumb movement. It's a trade-off, and what works best for you will depend on your symptoms and the activities that you want to be able to do whilst wearing the splint. In my experience, something like this is a good starting point, as it provides a good amount of support while still allowing a good range of thumb movement. The next step up would be something like this, which provides much more support but at the expense of thumb movement. You might struggle to get your thumb tip to your fingertip with this type of splint on. But that may be what's needed in your case. This type of splint also supports the wrist and therefore provides even more support, but only allows minimal hand function whilst you are wearing it. I'll put a link in the description below for all of these splints. When you first start wearing a splint, you should try to use it for most of the time, even at night if your pain is keeping you awake. The idea is to give your thumb as much rest as possible and allow it to calm down. About 6 weeks of maximum use is usually needed. Take it off when washing your hands and doing the gentle exercises we mentioned before to prevent stiffness, but otherwise leave it on for the rest of the time. After about 6 weeks, if it's working well, your thumb pain should have improved and you can now slowly start to wean off the splint over the next few weeks. During this time, one of two things will happen. 1, you might be lucky and the thumb pain might have settled right down, and as long as you can avoid those strenuous activities that aggravated it in the first place, it might stay pain-free. Or 2, your thumb pain might return as you start reducing the splint use. If that happens, then you might need to continue using the splint for the long term, but use it just as much as you need to in order to keep the symptoms at bay. You will have discovered the right amount of time to use it during the weaning process. The other common treatment for thumb base osteoarthritis are simple painkillers and anti-inflammatories. A short course of anti-inflammatory tablets such as ibuprofen can be helpful in settling down a painful flare-up. Anti-inflammatory gel rubbed into the thumb base can also be very effective and can be used in the longer term. But always speak to a pharmacist or prescribing clinician before using anti-inflammatories, as not everyone can take them. Recent studies have also found that using a cream derived from chili peppers called capsaicin cream can help with arthritic joint pain when used regularly. In the UK, this is a prescription-only medicine, and so you'll need to see a prescribing clinician first. If your thumb pain still persists, despite the use of exercises, splints, and by modifying your activities, then you may need to talk to a healthcare professional about some of the other options, including injections and surgery. A cortisone injection can be a very effective treatment to settle pain and swelling, but they should be used sparingly, as cortisone can be harmful if used too much. Other injections that can be considered are the viscosupplementation injections based on hyaluronic acid, PRP injections and stem cell injections. These are specialised injections usually done under image guidance, and you'd need to consult a specialist hand clinician. Finally, if you're still struggling with thumb pain that is significantly affecting your quality of life, then you might need to talk to a hand surgeon. There are a number of different procedures available to help with thumb base osteoarthritis, depending on the particular joints involved, your age, and the type of activities you're expecting to do. And that's it. Please feel free to leave any comments below, but please be aware that I can't provide any personal advice. I do hope the video has been helpful. Thanks very much for watching, and bye for now.